The contagious coronavirus has infected around 91,000 people in close to 70 countries including India, where there have been 28 confirmed cases so far. Well, prevention is the need of the hour. How can we prevent the spread of the virus? We have tried to answer some of the most frequently asked questions about coronavirus infection. How does coronavirus spread? The virus cannot travel by itself. Its most common carrier is respiratory droplets or saliva. So, when an infected person coughs or sneezes, the ejected saliva droplets infect others in their vicinity. So, to avoid infection, doctors recommend maintaining a distance of at least 1 meter or 3 feet from the sick person.
What are the symptoms of coronavirus infection? Unlike other life-threatening diseases, the symptoms shown in the coronavirus disease are not distinct. They are more like common cold and cough, such as fever, dry cough, exhaustion, shortness of breath, sore throat, headaches, muscle aches, and chills. Some less frequent symptoms are nausea and vomiting, stuffy nose and diarrhea. Running nose is not a symptom of coronavirus.
Is there any treatment found to combat the virus? Despite toiling hard, scientists have so far not been able to find proven drugs or vaccines for effective treatment of the disease.
What are standard recommendations to prevent infection? Standard recommendations to prevent an infection include washing hands regularly, avoiding close contact with anyone showing symptoms of respiratory illness like coughing and sneezing, avoiding frequently touching your face, and thoroughly cooking meat and eggs.
If you are suspected of infection but test negative, are you out of danger? Well, a single negative test may not rule out infection. Repeat testing may be necessary to determine if a suspected person has been infected or when a patient is no longer infectious.
Who is more prone to the virus? According to a report commissioned by the World Health Organization, both men and women are equally prone to the infection. In China, where the virus was first reported, only 2.8% of the infected women died from the disease, while 4.7% of the infected men died. The disease appears to be not more severe in pregnant women than in others. In 9 examined births of infected women, the children were born by cesarean section and healthy, without being infected themselves. The women were infected in the last trimester of pregnancy. What effect an infection in the first or second trimester has on embryos is currently unclear, as these children are still unborn. Besides, the younger you are, the less likely you are to be infected. And even if you get infected, there is very less chance that you will be seriously ill.
Can kissing an infected person lead to transmission of coronavirus? Kissing an infected person could definitely infect the other, according to a New York Times report quoting several experts.
Now, can you get infected from your pet? According to the WHO, there is no evidence that companions or pets such as cats and dogs have been infected or could spread the virus.
Is there any factor that triggers the spread of the virus? Well, a new medical study published by MediArchive suggests that temperature factors could significantly change the impact of coronavirus, with the virus transmission increasing in places with lower temperatures.